Person-centred care to me means that we treat every patient or every client, every consumer as an individual. We need to treat our patients in the same way we would want our loved ones cared for. We know based on talking with our patients and their carers and consumers of services that what they want most is they want to be respected. They want to know that we're communicating with them, that our caregivers, our teams are communicating with each other. And they also want to know that we respond in a timely way, that we anticipate their needs, that we're not keeping people waiting.
But my mother developed an infection following surgery, so she had to come back into the hospital, and she's been here for the last 2 or 3 weeks. Acknowledgement by doctors and nurses of family members when they're there is really important.
I think it's really important that health professionals are able to easily understand what it's like to be on the other side of the service.
Across our units at Melbourne Health, we want to have a reputation of strong person-centred care. The other day I was visiting one of our patients in the intensive care unit, and one of their family members said to me, "This place gets it right every time." And that's what we want across all our units.
We have some really well-qualified critical care nurses. One of them is in the training course, almost finished. So she can look after you if you arrest, something happens to you, right from giving you great information going home. And we've got one particular patient who's travelled a longer journey than most in cardiac surgery. And he expressed a wish to actually see the outside. So she packed him up, got everything organised, and said, "Yeah, we can make that happen." So down they went to have a look at the trams, and they were down there for about half an hour, and he was safe, and she kept him safe, and then oxygen and everything hooked up, and then they came back again. The smile on the patient's face after going down and coming back up again was a sight to behold. I think that's really good patient-centred care.
My association with the hospital has been through a stay, which was at the beginning of 2011, where I had acute myeloid leukemia and was treated in 5 North for about 8 months.
What's really important to me as a patient to be communicated as to the outcomes of the operation, how long until be able to walk, work maybe, medication.
There are so many aspects of the patient's perspective that are important to us as we deliver our care.
When I go to hospital, I'm usually feeling insecure and fearful of what's going to happen to me. It's terribly important that the doctor or nurse imagine what it's like to be in my shoes.
Most of the time, people that worked in the hospital actually made me feel like connected to the real world, that there was actually people out there. They'd come by your bed and sweep under your bed and say, "Hello, how are you?" And it just made me feel like I'd grab somebody and go, "What's it like outside?" Like there's a rule of 2 per visit, but they allowed my children and my husband to visit me. They came every day.
On our ward, we look after the sickest of the sick patients in this hospital, and it's all about looking after the person at the centre of it. I think it's about remembering that we're here because of the patients and the families that come here to receive care.
It's important that we demonstrate caring, compassion, and that the patients feel we're treating them as individuals rather than as part of anatomy or as a number.
The gentle thoroughness with which Gareth was treated, and the way that people bending over to try and make his leg comfortable.
It was very important for me to know that my friends and my family were well informed, and they came to visit me and knew what was going on, because I couldn't do much for them. I wasn't able to comfort them or tell them what was wrong with me. So it was important that they were informed.
Coordination of the medical staff with keeping everyone informed, in you as the patient and also your family members, because one of the most frustrating things as a patient is obviously to be in the hospital and just be in a bed and not know what's going on with your diagnosis or your prognosis.
And they've actually been proactive, so I haven't even had to ask what's happening. They've actually come up and started telling me what is going on.
The guys here do a fantastic job at taking what's complex and quite scary for people and putting it in a language that's meaningful for them. We've tried really hard to actually encourage people to get rid of language that people don't understand and is foreign. The hospital environment is foreign enough. You don't need to start adding abbreviations that everyone but the patient understands.
Having the communication really calms down the nerves a lot.
We all have a million things going on. We all have to rush around here and there, but at the end of the day, nothing else matters except the patient in front of you and how well you can care for them. And it's as simple and as hard as that.
I remember that it's perhaps the small things that we do that make the most difference.
Yeah, and just giving results to me in a timely manner, keeping my family informed and the people who are close to me as well. So,
as a carer, visiting hours are important to me, my family and my mother, because we want to get in there and see her as much as we can. But also for my own emotional well-being as well, being able to see her, especially when she's very sick.
Person-centred care is a way of working, a way of engagement, a way of being caring, compassionate and thoughtful in the way we work with our patients and their family members, those that love them most.
As a patient, I may not remember all the things that you have done for me, but I will remember the way that you've made me feel.
I think it's really important that health professionals are easily able to understand the perspective of a patient or their carer or their relatives. And I certainly have been down those paths myself. In my final few weeks as a medical student, my wife was in intensive care, having had emergency surgery, having had a tracheostomy, was quite seriously ill. More recently, my second wife died of cancer, having had a year's treatment of chemotherapy and so on. So I have been through those difficult times, and I think it's important that we all learn the lessons of being on the other side. There have been many examples now where hospitals and health services have not listened to their patients or their carers and have managed to, in many cases, really hurt and harm patients as a consequence. So to me, person-centred care is an absolute must.